Africa, the cradle of mankind, a continent so ravaged by the effects of COVID-19 pandemic, and was already on her knees following the waves of other epidemics that had crippled the socio-economic welfare of the region in recent decades, including the Ebola outbreaks. Pundits agreed that the effects of the pandemic would be catastrophic to Africa, well before the first case was reported in the region. According to the World Health Organization, approximately over 298 million cases of COVID-19 and 5.4 million associated deaths had been reported globally as of 7th January 2022. 7.5 million cases and 157,000 deaths have been reported in Africa, which is much lower than what experts had predicted. Kenya is the second most hit country in the East African region, after Ethiopia with 1,000 and 400,000 cases respectively, and over 5,400 deaths in Kenya due to COVID-19 according to official statistics by the World Health Organization. Since the start of the pandemic in January 2020, African countries have continued to show resilience against COVID-19, though the impact has been far-reaching on the populations. The fight against COVID-19 has not been an easy one for Kenya, with many lessons learned as the pandemic evolves.
These pharmacies that are selling
Apparent inequalities have been witnessed in terms of access to COVID-19 testing, treatment and vaccination across the nation. Stockouts of vaccine, COVID-19 tests and essential medical supplies, chronic shortage of healthcare workers, limited isolation capacity, amongst others, continue to exert more pressure on the country's healthcare system. To mitigate the devastating effects of COVID-19, Kenya has been working closely with her strategic partners at both the national and county governments in strengthening her resilience as the pandemic rages on.
I'd like to thank our partners through the Betsi Kenya link. This is a discussion that we started some years ago.
One such partner is the Betsi Kenya Health Link between Busia County in Western Kenya and Betsi Cardwell University Health Board in Wales. Through the partnership, 68 healthcare workers have so far been trained and supported to undertake surveillance activities in their respective communities in liaison with the public health authorities in Busia County. The partnership is funded by the Welsh Government's Wales African Grant Scheme. There is no doubt that such an initiative will significantly boost the county's efforts in keeping the virus at bay and protect.
Currently we are having a spike in terms of cases of corona, and I believe it will be an opportunity for us to get to the community because of the challenges that we have in terms of resources and being able to get to the community. I believe that we shall support each other.
We are so privileged as a county to be among the pilot counties in Kenya undertaking community-based surveillance activities. So we are proud that our contribution and our experiences and all those things that will come out of this pilot will be able to inform Africa and the world that community-based surveillance systems are possible. It's an activity that can happen, and the beauty of it all that it will add value to the existing surveillance systems and mechanisms that are in place.
Speaking during the launch of the initiative was Dr. David Mukabi, the Director of Health Busia County, who lauded Betsi Kenya Health Link.
What we are required to do is to ensure that we are also moving with the trends, especially in terms of our preparedness to be able to deal with whatever comes.
The training initiative involved different groups of healthcare workers involved in the public health surveillance from the community to the county level.
I'm reporting from Butula Sub-County, where we've taken the next step to sensitize and train community health volunteers on community event-based surveillance. Yesterday we had the opportunity to sensitize sub-county coordinators and field supervisors. But the ultimate goal was to train and sensitize community health volunteers who operate in all villages and cover several households under their jurisdictions.
The training covered aspects of public health surveillance, how to implement community-based surveillance within the context of COVID-19, preventing the spread of COVID-19, protecting the vulnerable populations, and how to cope with the mental health issues during the pandemic. The training was rigorous, as testified by the community healthcare professionals, who showed dedication in gaining skills to enhance their surveillance activities. Considering the ongoing threats of coronavirus, partly orchestrated by a high volume of international travel across the Kenya-Uganda border, this initiative will strengthen Busia County's capacity to mitigate the effects of the pandemic.
We have been challenged with this COVID pandemic. At the moment, we have 5,881 cases, which has been confirmed of COVID-19. And Busia is very unique on its own. And we are having two borders, that is both Malaba and the Busia town here. All these are gateway to East Africa, but through Uganda.
In the long run, the vulnerable members of the society will be protected from the reeling effects of COVID-19.